Here's a patient who has neglected his teeth for most of his life, and it was time for him to have a healthy smile. A lot of different materials going on here, lots of decay. So in the next few minutes, I'm going to go through the entire case for you to see exactly how we started, what the preparations look like, what the porcelain looks like, and what the final case looks like. So let's jump right into it. Here's aesthetically, we're going to discuss just understanding, obviously, smile design here. The architecture of his right side needs to be brought down a little bit. Those teeth are a little short. I think one of the best teeth in his mouth position-wise is these ones right here. So essentially, we're going to be building the entire smile to that. As you can tell, his hygiene needs to be improved. He has a missing tooth for an implant here and a tremendous amount of decay everywhere. These teeth on that side are crowns. So there's basically every different material that I use is in this case, and I'm going to show you exactly how we went from that to this to 2 year post-op, and then for many, many more years to follow. So he started here. These are the preparations. As we can see, this tooth had a root canal. So this root canal treated tooth is darker, and that's why it's darker than the rest of the smile. So if we look at these preparations, these are crowns on the left side. These are traditional veneer preparations. These are all 3/4 veneers, so meaning I finished the porcelain on the back side, on the inside aspect of the teeth. And most of the back teeth are inlay, onlay veneers, which wrap around the edge and go over the top or go directly into where the decay used to be. So you can see the other important component here is the color of that tooth. Needs to be communicated to my ceramist so that we're able to fully block out the discoloration of that tooth so that the rest of the smile flows exactly how it should. The color of the rest of the teeth is different than that one. You can see on this photo it's 4M1 using a 3D Vista shade guide. And the rest of the smile is 2L 2.5 on the top and on the bottom. So if we look at this right here, we see there's a tremendous amount of decay everywhere, crowns right here. This is that root canal treated tooth, and we're basically going to be cleaning out all of these teeth and putting on clean new restoration. So crowns look like preparations obviously go 360 degrees around the tooth. 3/4 veneers go around the facial and basically keeping the integrity of the inside part of the tooth. And then these preparations right here remove the decay from this tooth. That's what it looks like on the models. You can see inlay veneers, 3/4 veneers, and crowns. That's what it looks like in the mouth. That's the root canal treated tooth. And those are all the margins for the inlay veneers, 3/4 veneers, and crown preparations. From the front, you're able to see we maintain some translucency and a nice bright color in the front. On the bottom, it's the same thing. These are going to all be traditional veneer preparations, and then wherever there's decay, that gets completely cleaned out. So this one gets all cleaned out, all of these, and then these are the veneer preparations. You can see basically what needs to happen is there needs to be an outline for the veneer to slip on and go over on the back. Don't need to break through all of the contacts in order to have a healthy and good restoration. This is what the veneers look like on the models. And then moving forward as well, here's this implant crown here, which is a screw retained crown, implant crown. And these are all the restorations, traditional crowns, inlay, onlay veneers, and traditional veneers. This is where we started. This is where we finished. You can see higher here, and then as we moved on, we lowered and lengthened this. Not that if we compare this to the other side, you're like, whoa, this is much smaller, this is much larger, but you can't look at the teeth when you're retracted. You have to look at the smile. And so Here it is in the smile. These are his teeth. We follow the architecture of his lower lip. That's where we started. Discoloration, same thing on the top. That's where we started. And this is where we finished. Healthy, vibrant, youthful smile that he's going to love and have confidence. And now he learned how to smile, and he loves coming to see our hygienist for routine care and has amazing, exceptional home care as well. Those are the key to success for longevity. Regardless of where your smile starts, it's really important that when you do tackle this, that you forget about your old habits and you build new healthy habits. And that's what we love to do here, create beautiful smiles.